Before we begin today's video, remember we have already created a comprehensive guide kind of a video about practicing in Netherlands after BDS in India. Before checking this video out, I hope you have checked that video. If you have not, please go and check it out. It is given in the description below. In today's video, Dr. Renu Punnakkan is going to tell us about her journey of practicing as a dentist in Netherlands after her BDS in India. She is also going to answer a few questions we all have in our mind when we are thinking of making that shift. She completed her BDS from Sri Ramakrishna Dental College and Hospital, Coimbatore. She then worked in Mahe Dental College, Puducherry and JSS Dental College, Mysore. In 2021, she got registered as a dentist in Netherlands. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Renu. Thank you for joining us today. So the first thing when you're practicing in Netherlands is you have to learn the language. My question to you is it easy to learn the language or what did you find it difficult?
First of all, thank you, Dr. Satish, for having me here. And if we go to the question, that is not a easy language. I can say, like all other languages, it has its own challenges. But for me, what has helped is actually working in clinics. So when you are constantly being in communication with patients or your colleagues, you could learn it a bit faster rather than attending classes. I did attend the classes. So the thing is, if you want to work in Netherlands as a dentist, you need to have at least B2 level of Netherlands, of Dutch language. And for that, I did attend 4 level of classes, but also in addition to it, being somewhere in touch with the local people to help a lot.
Understood. So it's basically that regular conversation which gave you a help and a boost to understand the entire language.
Yeah. The thing is, like when you keep on hearing it, you pick up really fast. And also that will help you in classes to correlate, okay, what's happening and what is being taught. That did help me a lot.
Understood. Is there any difference in the dentistry which is practiced there and in India? Because you have a dental exam also, so you have to write it in Dutch. So did you join any classes for it? Did you have to learn separately that? How did you go about it? Before you listen to the answer to that question, I hope you're enjoying the video. If you are, please do not forget to hit the like button below. And are you planning to take your career to the next level after BDS? Then if yes, I'm sure this is a channel you need to subscribe to. So do not forget to hit the subscriber button below.
Here the exams, it's like you have 2 exams, and first is the language exam. It's called AKV Toots, and that's like it happens in 4 steps. And that's purely how to test your language. And in that 4 exams, one is also an English exam. And after that, you have a dental exam, and that's completely in Dutch. The first exams, it depends upon how good you learned your language. And there you can attend the classes for your language, like I said, like B2 level. And then once you finish the exam and once you clear the language exam, it's like an institute here called ACTA. That is the university who conducts here the dental exams. And they don't provide you with the materials, but you also have practical exams. So they do help you with the practical exams because you have to do it here in a special 3D machine called Simodont. And because we never have that opportunity in India, and I think it's not everywhere. I think it's only US and Netherlands that Simodont is there. And there you'll get an like particular number of days where you can go to the university and practice for the practical exams. But for as such theory, it's like it's learned by yourself. You don't have any places where they train you or something. And you can either download the books, dental books, which is in Dutch, or you get summaries in the websites which you can help, and also the old exam papers for the students who have done the exams. So as such, we don't have any place like coaching places which gives you help for clearing the exams.
Understood. Now, is the exam very difficult to give or how is it?
It's not easy. It's not an easy one. Yeah, first of all, for me, I had a gap between the theory part when I studied and came out of the college, and we were always doing only work. So theory goes a bit out of your head. But yeah, once you start getting into the process, I think, okay, you remember the things and you just get into it. But also getting in contact with the people who are doing it, the exams at the same time do help a lot. So discussions and things, it does. But you can do it. It's
And
possible.
is there a limited attempts you can give if you don't pass in the first attempt? Is there something of that sort?
No, for the ACAFE, the first exam, that's like the language exams. I think you can attempt until you finish it, like until you clear all the four exams. But for the second exams, there are specific criteria. I'm not so sure of it, but like if you lose one paper or two paper, I'm not sure of how much attempts you can take for it. But there
Understood.
are, yes, that's not sure everywhere. What are the criteria for that?
Understood. How many papers are there for the written exam?
For the written exam, it's like four theory papers will be there, and these four theory papers they will cover all the subjects from our first year to final year, and it'll be divided like in one paper. It'll be like few subjects and others like that, and then you have one we call it as patientgesprek. It's like a patient to talk to the patient. It's like an interview or how you manage in a clinic. You have that, and then you have an ethics paper. That's also a different one. And then you have like three Bahandal plan. Bahandal plan is the case history. They will give you like x-rays and the situations, and then you need to make a case history, like how you make a treatment plan. That's the thing, and treatment plan. And these are how the theory exam goes.
Understood. So there's more focus on the clinical aspects and whether you can actually manage patients. So these exams
Yeah.
focus on that.
Yes, yes. And also what you have one more subject. There are also few subjects which we really don't have in India. We don't learn in India. You have also like your like statistics and methodology also as a theory paper. Then we don't have that in India. So you have to learn that. And that's also there for an exam. And yeah, the rest was almost same, and a few different things like what they have importance here that we didn't have a lot in India. So that's it.
Understood. So now you clear your language exam, you clear your theory and practical exam, and then
Mhm.
after that, what are the job opportunities out there? If someone clears it, is it easy to get a job?
Yeah, once you have, we call it as a big number. That's a registration number. What we call here. And as of now, I think it's not so difficult to find a place to work because there's also in Netherlands now happening is a bit of shortage of dentists. And once you're a registered dentist here, it's not so difficult as per the
Understood.
situation.
So what is the starting salary there for a dentist?
Here, as a dentist, you don't have a fixed salary rate. So most of us work, or most of the dentists here works like a freelancers, and it's mostly like a kind of percentage what you get for the work you do. But it really depends upon. It varies from clinic to clinic. You can they decide with the people who are working how they want to work and what will be the salary basis. But as of now, according to my information, there is no like a perfect salary range they give here. So most of them go for a freelancing.
Understood. So now you go there into the clinics, okay, since you're an Indian or a South Asian person, how do you adapt? Is there patient acceptance for people who are not from Netherlands?
Yeah, and it's good here actually because as you speak a language good, they do really accept you. So if you speak fluent Dutch or things, I never faced something like, yeah, you're from a dentist from abroad, or you didn't study here. That didn't I didn't face something like that till now. So it is going till now really smooth.
Understood. So basically, if you make an effort to learn their language, they don't mind you treating them.
No, what I felt till now, if you make that effort to adapt to the place, like especially of learning the languages, they really do accept you here.
Got it. Is there anything you wished someone told you at the start of the process?
Yeah, for me, the time when I came here, there were not my experience. There were not a lot of dentists, like especially also from India, whom I could contact, whom I knew that do the procedures. But now it's becoming more. It's getting exposed. Like I can know because more people are doing. They have a lot of informations, and it's getting a bit more easier compared to what I have faced. So I think now more information is available since a lot of people are doing it. So it's getting a bit more easy.
Understood. Is there any advice you want to give someone who's planning to start this process?
Yeah, the only one advice, don't wait. Just start your language as soon as possible if you want to go through the exams, because that is the basis. Because once you are really good in language, and that's the best thing to apply also. And also, I would suggest not to apply for evaluation of the certificates as soon as you come here, because once the evaluation of the certificates are done, they will give you only a 1 year time. Within 1 year, you have to take your first exam. So if you're not sure, or if you're not clear with the language, then it would be a bit difficult within 1 year to give the exams, and then you are necessarily losing the years. So I think the thing is, you can first finish, or you can be thorough in your language, and then apply for the valuation of your certificates.
Oh, that's a really good advice because a lot of people will do it reverse. They'll first go in for the evaluation, then think about it. So what you
Yeah,
told is amazing advice out there.
yeah. So that's what that kind of informations are not so much available. And once we reached, and once also I came, I thought, okay, I'll go through it. But then I got to know, yeah, they give you a particular like 1 year, and if you are already thorough, it's easy. Otherwise, it's gonna take more time, and then it's just gonna drag the process.
Understood. So Dr. Renu, now if someone wants to start the process, how can they contact you?
You can contact me on my Instagram page, and I think Dr. Sadish will share the link of my Instagram page. So if you have any queries, you can just contact me there.
Great, I'll do that. Thank you, Dr. Renu. It is really amazing that you have taken time and joined us today to give this valuable content to our audience. Thanks a lot. If you like this video, I'm sure you're going to enjoy our other two videos in which we explain the process of working in other countries in Europe after your BDS. Do go and check them out.